received anyone, I would entertain a motion to approve the appointment of Amy Doyle to the Community Mental Health Board.
I'll make that motion.
Support.
Moved and supported.
So we've had to go over in several different applications because of the number of individuals that have been in certain positions, and we can only have so many under statutory requirements that can be in this field and that field and this field. Amy checks the boxes according to what I've discussed with Ryan, and who's the director of, or CEO of Community Mental Health, and it has been recommended by their board chair as well as our board chair to appoint Amy to that position. There are some other individuals that are interested in being appointed, but they're in a government wing, and until something changes with the who's on the board, they can't be appointed, but this one does meet the qualifications.
Yeah, and it was really unfortunate because we had some excellent candidates, and not that this person isn't excellent, but you know, it really narrows our scope at this point. So, anything further on that? All those in favor signify by saying aye.
Aye.
All those opposed the same, and that will come back tomorrow. I would look for a motion to allocate up to $30,000 of opioid settlement funds to the health department to provide drug remediation support for New Directions consumers.
I'll make the motion.
And I'll support it.
Moved and supported.
So, as you know, the opioid settlement money that we have received because of because of the series of lawsuits that we've been part of, has to be used for drug remediation and treatment. It can't just be put into the general fund, or it can't just be used for regular government operations as part of the settlement with all these different opioid manufacturers. As part of that, we have looked at yesterday using some of the money for jail nurses. In this particular case, we're looking at allocating some of it to the health department to provide an additional service. And this particular service would be to the individuals at New Directions, which is related to community mental health. And with the chair's permission, I'd like to introduce Ryan Painter, the CEO of Community Mental Health, and Deb to talk. Deb, what's your last name? Deb, to talk a little bit about what New Directions is and what the services are that they provide. And then Larry would use some of his existing staff to provide support to them related to drug remediation. And he can talk slightly about that.
I'm not going to put Deb on the spot. I didn't tell her she'd have to come and talk. Deb Hull is the director of New Directions. First of all, let me say thank you for even considering us. This is a real, if you do vote for this is a real win for the little guy. And New Directions, even among all the programs that we support and do in community mental health, this is one that really helps and supports the most vulnerable of the vulnerable. They get by on a shoestring budget. They do a tremendous amount of work with their underserved population. There's a lot of programming there. There are a lot of things that folks go there regularly for, everything from doing their laundry to taking showers to socializing to learning how to make a meal and break bread with one another. We had a blast during the recent fundraiser with Mr. Lasso, learning how to wash people's cars and do it as fast as we could. And we got there. We washed a lot of cars. Some of you came by, and I appreciate that. We had a yard sale to raise money. We had a cookout to raise money. When I go there now, everyone knows who I am. Before, there was a distance. You know, there's this guy in a suit. Why is he here? He's not one of us. Now I go in, and everybody's slapping me on the back and giving me a bright smile because we gave them some attention and we gave them some focus, and that's something that they've never had before. And I don't just mean from my predecessor or from community mental health or from the Medicaid apparatus of the county. I mean in their lives. You know, these are people who've never really had someone there to give them a little bit of the sunshine. So, you know, if the county can do this for them, given how much we stretch the dollars that we have, given you know, the great work that our health department does and that Larry Johnson does, I'm really, really excited that we're going to have lot of proactive and positive change that comes because of this. This is the seed, the kernel, that will lead to some great things. So with that, I'll turn it over to Larry. Is there anything to add?
Yeah, appreciate it. I was happy to actually accompany the commissioners, Dr. Boggs, on a tour of this facility recently. I wasn't even really aware of it or that it was even there. And I saw some pretty amazing things happening over there, and we see some real potential here for this partnership. More specifically for the health department, we're going to allocate some nursing time over to the facility that can take part in some health education things related to Narcan, harm reduction, the needle exchange box that we have over at the health department, different things related that could tie into opioids. But beyond that, there's a potential for referral to other services at the health department, referral to community partners, and a Medicaid touch point for Medicaid outreach. And there's a real potential there for potential reimbursement from Medicaid, depending on how things go with Medicaid. So that's kind of up in the air right now. But just exciting potential to use some of the funds in the county for county programs. So I'm very thankful that this opportunity came up. As you know, we've had some tough budget times at the health department, and this is a real nice opportunity. So I'd like to thank the board for that.
How long is it gonna last?
Well, that's still being worked out.
So-
I'll turn that over to.
Here, there's two things to think about. So this is a $30,000 allocation. So when Larry burns through the $30,000, hopefully not before the end of this fiscal year, we'll then take a look at it and see about putting it in the budget for next year. Or if he does not go through the full amount of the $30,000 by the end of the year, we'll carry it over to the following year. But this won't be any amount of money given to New Directions. It will be given to the health department for the health department to provide services to New Directions. So it's not leaving the county, or leaving the county system. It's not being gifted over, but they will provide services to them through a different budget allocation. So however, he's going to put the program together and see how long it takes him to go through it.
Will we have more money left over for,
We have received so far $1.5 million, and
how quick we gotta burn it?
we don't have a time frame.
Oh, I just thought of
Yeah,
that.
no, we did with some of the other ones, as you know, we had to allocate them by the end of a year or end of
Yeah.
a quarter or whatever. This one, we don't have to.
Well,
but-
that's kinda nice, you can kinda
Yeah.
help out a little bit instead of splashing.
Yeah, so we'll see how it works, and then we'll revisit it by the end of the year with the board.
Okay.
Yeah, and I like that, so the idea that this is a new partnership, and like Larry said, he hadn't been there before, so I guess we don't really know what to expect. It may turn into something great, it may turn into something middle of the road, we don't know. So, and that's what I like about it, is we can kind of tweak it as we go. Maybe the potential, like you said, for even more services, but we won't know until we try. So, and I do want to thank you, Ryan, for running for Mr. Shiawassee. It was just really, it all kind of came together, didn't it?
The most fun I never want to do again.
Hey, Tracy and I were there at the car wash, so no, that was good. And I guess, Deb, you don't want to speak? Is that what I'm hearing?
I think they did it for me.
Okay. I did have just one additional question, and I think I asked it before and wrote it down. About how many people do you serve?
We can serve anywhere between 20 to 35 a day.
A day, okay. And that's 4 days a week, right?
Correct.
Okay. All right, did anybody else have any questions, anything to add? All right, all those in favor signify by saying aye. Aye. All those opposed the same, and we will see that come up again tomorrow. I would look for a motion to approve the contract extension for medical examiner services with Sparrow Hospital Association. Josh, I'll make that. All right, it's been moved.
Support.
Moved and supported.
So one of the departments that I oversee is the medical examiner's office. And it's a contracted service with Sparrow Hospital. anytime that there is a death in a home or related to an accident or some kind of police activity, someone from the medical examiner's office comes out and checks to make sure that there weren't any particular circumstances that might require further investigation or police action or other things like that. And they also perform autopsies for us, and they also take care of and dispose of bodies, particularly unclaimed ones, in addition to running some of the different tests that we need for autopsies. They are planning on increasing the ask from about $205,000 to about $250,000. However, we had a weird start and end time of our contract. Our contract began in the middle of July sometime with them, as opposed to a fiscal year. And when they discussed raising it, I told them that that wasn't going to work for us because we've already budgeted for this year, and there wasn't going to be additional money from now until the end of the year to cover such an increase. And they agreed to do a contract extension under the same rate and the same amount that we're currently paying between now and the end of the year. And then we will go to a January 1 to December 30th contract. We will begin negotiating that contract after this extension is approved, which is the same contract that all the other counties have as far as the fiscal year alignment. So this is just an extension of the current services.
I was just curious, and I know that we probably don't have this readily available, but could we find out like how many times we use the services?
Yeah, actually, I do get a report quarterly about different things that they do. I would provide it to you.
Yeah, I'm just interested. Do they come out 10 times, 50 times, 100 times? I don't have any idea.
Well, I will look and get back to you. I do know that last year there were 8 or 9 unclaimed bodies that were part of their services. So I will find out those numbers.
I guess I had one question. Is there a reason we partner with Sparrow and not with a different?
They're the only ones in this region that do it.
Okay.
I've asked
Easy answer,
Memorial,
yeah.
and so they do in 5 or 6 counties, and we're one of the 5 or 6 counties all around the Lansing area.
Okay, that's fair.
Would it be more cost effective if we were billed on E&E type service, or instead of?
And we can look at that for the next contract, but that's not gonna help us for the extension. So we have to negotiate the next one.
And I would imagine if they were willing to do that, they would have made that offer. I kind of wonder, and we had kind of a bonus for Ryan Painter being here. He mentioned that in Indiana, those were elected positions, or could be elected. So we were just doing some searching real quick, and there may be an alternative, probably not, but one that just might be.
The board could appoint its own medical examiner, which has to be a doctor, but the issue is they also have to have the facilities, and they have to be available 24/7. So they have to have the facilities to be able to do an autopsy, and they have to be able to go to someone's home, and they also have to be able to transport bodies.
And Sparrow is the only health center or system that has it in the area.
And they work in conjunction with some of the local funeral homes to transport the bodies.
If they, so if there was one person that was designated to do that, and they worked with the Sparrow facility, but could they do like a conjunction thing? Is there any?
It wouldn't be cost effective.
Okay.
You'd split the contract, and then it would cost more in the end.
Oh yeah, okay.
And I would imagine Sparrow's not interested in saving us money,
No.
so.
It's kind of a gotcha.
Right.
You could go the other way. I'm sure that we could find someone in the greater Flint area, but
No.
it has been, we've been trying to Lansing for.
At least we haven't gotten any complaints from the customers.
No.
Right, none that we know of.
Not that we know. Larry liked that one. Larry liked that one a lot. That's good. Yeah.
So, the other thing that they take care of that we don't have to deal with is they take care of the unclaimed bodies. So, if you go to an independent entity or you hire someone, we also have to bury and take care of the unclaimed.
So they're actually.
Yeah, so every year I go to they do it on All Souls Day, and the Lansing accepts all of the bodies of the unclaimed from the 5 counties, or 5 or 6 counties, and they do a mass internment at, I think it's St. Joseph's in Lansing, and they take all the bodies.
I went to the last one, and it was strangely touching and sad to think of these people with no one at the end of their lives.
There were 100 and some bodies that were interned and 16 or 17 children.
In a 5-county area. Wow.
And we had 8, you said?
I'm gonna have to go back and look
About.
at the number, but I think it was about 8.
Wow.
It's in my email somewhere.
Yeah. It is sad.
And through a partnership with the Diocese of Lansing, they took the bodies and were cremated and turned in the crypt, the All Souls crypt.
Very cool, thank you. All right, anything further on that morbid topic? If not, all those in favor signify by saying aye. Aye. All those opposed the same, and we will look at that again tomorrow. Which brings us to our second call to the public, and seeing no one, we're adjourned. Thank you.